So hello, my name is Fardad. I'm a second-year medical student here at Medskl, and I'm here today to interview Dr. Karatsios, an infectious diseases specialist, on behalf of Medskl. So Medskl.com, that's for an online platform for the medical community to learn and thrive. So here we have Dr. Karatsios. Why don't you introduce yourself, please?
Good morning. My name is Dr. Christos Karatsios. I'm a pediatric infectious diseases specialist at the Montreal Children's Hospital, the McGill University Health Care Center, or the Glen site as we call it here in Montreal.
Right. And I'm not sure if this is studied yet, but so the antiviral medications that we have, Tamiflu or whatnot, do they seem to be any effective at all?
So Tamiflu has been studied at high doses. In and of itself, it doesn't work because it's against the flu. However, coronavirus does have similar mechanisms of budding out of cells. So Tamiflu, theoretically, in vitro, has some activity, but it has to be given at a higher dose than what is given in the flu. But it has to be also given in combination. So there's a few things that have been studied. There's some drugs that are out there right now that are being studied as well. But there's a combination of an anti-HIV drug, Kaletra, which is a protease inhibitor, with high doses of Tamiflu that have shown to decrease severity in places like Thailand, for instance. And this was, I only heard about it a month and a half ago. I haven't heard any larger studies. They were trying to do that in China as well. Again, the dust has not settled, and it's, China right now is just, post-shock, and they're trying to figure out what to do. So the studies on drug studies have not been published yet. But there are things that are out there. Whether they decrease severity by a couple of days, or decrease disease by a couple of days, or severity by a couple of notches, remains to be shown. So your next question, I'm assuming, is going to be on vaccines, and obviously we have to talk about that, but vaccines, we don't have any active vaccines out there now. There's many people, many groups, many countries around the world, including the United States and Israel, who are working on a vaccine. Israel is probably the closest. An Israeli group was looking at developing a vaccine for livestock and agricultural purposes on coronaviruses, and they just had to tweak it a little bit for human relevance. And they announced that they're months away, but we're still months away. It needs to be, human trials need to happen. We're not close to a vaccine probably for the next few months to a year, so we have to endure the first few waves of this coronavirus pandemic before we have a vaccine ready.
Right. And just a question back to what you mentioned about the vaccination for coronavirus. So this COVID-19 is from the family of coronaviruses.
Yes.
So since these are respiratory viruses, and just we've had them for a long time, and even the flu causes a lot of death per every year.
Mm-hmm.
And I know there are flu vaccinations. So why do we not have vaccinations more generally for more viruses in this family? Why is it a technical issue, or is it an investment and
for coronavirus in particular? Yeah. So it's probably, I don't think it's a technical issue. I think vaccines can be made for pretty much anything. There are certain pathogens that are not very immunogenic. I don't think coronavirus is one of those. I think that vaccines can and do exist for many things that we can put out there. I think it has to do with the fact that the vast majority of coronaviruses up until now have caused mild disease. Sure, we've seen SARS, we've seen MERS, now we're seeing SARS-2. SARS-1 disappeared after a few months. It caused a pandemic. Well, yes, I would call that a pandemic too, because there was local spread outside of China as well. It caused a pandemic, and it just disappeared. So the impetus to make a vaccine was not there afterwards. Sure, if it reared its head again, yeah. MERS coronavirus, the number of cases is low, even though the death rate is 30 to 40%, and it's its R naught is not high. It's like 1.5, 2. People die before they transmit it, is what I'm trying to say. So this one here is different, and I think it's making people think twice about having a vaccine, and there will be a vaccine because of this, but when is a different story. So I don't know the technical issues. I don't know once they start rolling it out into trials whether people actually form immunity that's long lasting, or will they have to be revaccinated every so often like the influenza vaccine. Or is it going to be a vaccine that is cross-reactive against all coronaviruses, or just this one? Remains to be seen.
Now, I'm going to ask a question. I'm going to play the devil's advocate.
Yes.
And I somewhat suspect what the answer is, but just for the general public. If people are dying, so why not give the vaccines that we think are the right ones to them in the meantime? So what could be worse than death, essentially?
Well, the thing is that you don't want to give vaccines that are not studied and cause side effects that may worsen somebody's condition. A hastily developed vaccine back in the 1970s against the swine flu, an H1N1 swine flu in the 70s, caused a lot of Guillain-Barré, a lot of paralysis, and a lot of paralysis of respiratory muscles. So here you have, people who have respiratory illness who cannot breathe, and then they develop Guillain-Barré because of the vaccine. That's not going to be helpful. We're not even close to having a vaccine ready, so there's no vaccine to be given. As I said, the Israeli group, this was a vaccine that was supposed to be given to livestock. The antigens are different. You can't give a vaccine that you give to cows, for instance, to humans, because they might react, and we have react negatively, whether allergic reaction or an anaphylaxis that cows don't. So we have to look at those carefully.
Perfect. Thank you.